Hello, and welcome to another episode of Healthcare Executive Insights Podcast. I'm your host, Mike Sloan. Today, we are very excited. We have Dr. Tara Chalakani with us today. She is from Preferred Behavioral Health Group, and their headquarters are in Lakewood, New Jersey. Welcome, Tara. How you doing?
I'm doing great, Mike. Thanks for having me.
Thanks for being with us. So tell us a little bit about Preferred. What do you guys do there?
So Preferred Behavioral Health Group is a community mental health organization. We've been around for over 45 years, and our biggest footprints are in Ocean and Monmouth counties. However, we provide behavioral health care in 15 out of the 21 counties in New Jersey. And we provide the entire continuum of mental health care services from birth. We say from 0 to 104 years old, because that was our oldest client at one point. We have prevention programs, traditional mental health programs, a full continuum of substance use services, residential services. And the easiest way to really describe what we do is we provide every program you can really think of aside from an inpatient hospital.
Interesting. So you have facilities all throughout the state and those counties, or is this kind of you're going into other facilities and providing a supplemental service? How does that work?
So our biggest footprint, where we have multiple locations with a variety of programs, is in Monmouth and Ocean County. But we have a number of programs that are grant funded that are embedded in other counties. Some are in local DCPMP offices, which most people know of as DIFIS. And we have other programs where we go into people's homes and provide them services in other counties. So they're not always brick and mortar programs or buildings. They can be, non-traditional type programs.
Gotcha. So what types of providers are as a part of the company?
So 80% of our workforce is clinical. So that consists of psychiatrists, nurse practitioners, social workers, professional counselors, psychologists. So that comprises about 80% of our workforce. And then the remaining 20% is, administrative or support staff. We have a lot of bachelor's level case managers and outreach workers. But that's pretty much what our workforce looks like.
Gotcha. So obviously mental health is such a hot button these days. All throughout COVID, there's you just hear stories and reports of this situation getting worse and worse. People are feeling isolated and depression is at all-time highs. How have you seen that evolve over the past really 2.5, 3 years?
Well, the blessing of COVID is that it put mental health on people's radars. Where in my world, it's always been on our radar. And we've always been really aware of what the statistics are and the prevalence of mental health disorders. But it, without a doubt, has just skyrocketed since COVID for all of the reasons that you named. And, the population that's really suffering the most are young people because, their nature is to be social, to be involved at school and sports, and their lives came to a screeching halt. And so prior to the pandemic, we knew in the healthcare, behavioral healthcare industry that 1 out of every 5 youths had a diagnosable mental health disorder. But now there are sources saying that it's about 51%. Wow. So, it's that population. And the funny thing is with older adults, like even seniors, they had the least impact during COVID. And, research tells us that, so many of them lived either alone or maybe with one other person, didn't go out much, didn't see friends or extended family except for holidays. So they weren't as impacted as younger people.
Makes sense. And how do you feel that even like social media plays a part in some of this stuff, right? I feel like, with adolescents these days, everybody's on social media all the time, comparing themselves to their peers, particularly in at times in like when everybody was quarantined, you'd still have these like social media influencers go out and they'd be traveling, quote unquote, and people see that and they're like, oh, I'm stuck at home with my parents or whatever. And that's got to exacerbate it. Yeah, 100%.
Yeah.
How do you address that? And how does that, handled?
I mean, social media has a tremendous impact on all of us, but young people specifically because of the fact that, their brains aren't fully developed, so they're processing all this information at warp speed, which their brains aren't really set up. None of ours are really. And then to see the social piece, what they're missing out on, friends going out and not inviting them, or, you just broke up with someone and now they're with someone else. It's like all the things that I think earlier generations experienced, but it's like, it's all in real time. And, they have no breathing room. And prior to the pandemic, the research on impact of screen time on mental health was something that I was so passionate about. And I was going all around the state and doing webinars and teaching people. And then all of a sudden COVID happened and they're on screen all day long for school. They're on the screen to entertain themselves in this weird world where you can't leave your house. So all of those presentations went out the window because it's like it's a losing battle now. There's no filter. And kids, really like even when they're in school now in the traditional sense, their homework is online. Like it's I hear all sorts of statistics like 12 hours a day, 10 hours a day, 9 hours a day, but kids are on screens nonstop and it absolutely impacts their mental health.
100%. I mean, even my wife's an elementary school teacher, and I think it is mandatory now by second or third grade, the kids have to have a computer at home to do their homework and stuff like that. Yeah. It's wild.
Oh, I know. It's crazy. It's crazy. And, the statistics are just not even kids, just the general public, that 66% of adults that have seen something on social media has experienced an intense emotional reaction or maybe even depressive symptoms because of something they saw. So if we're adults, and educated and evolved, and we get upset by things that we see or read on social media, how is a child whose brain is not developed, who's can't handle the intensity of the emotions, what are they supposed to do with that? How are they supposed to cope with that?
Yeah, for sure. It's crazy. And and then you see these more emergent type situations, right? Where I've even seen they have now like mental health urgent cares that are strictly for mental health. And that's becoming more of a regular thing. So tell me a little bit how you guys handle those type of emergent situations and how is that, incorporated into your overall services that are offered?
Sure. So, I mean, we have clinicians on call 24 hours a day. So, and well, as well as a psychiatrist. So we have the capacity to at least receive a phone call, kind of triage what's going on, and either send someone where they need to be or schedule them for an appointment. So we do have that capacity. For children, we have what's called Children's Mobile Response and Stabilization Services. It's county specific. Every county in New Jersey has mobile response. We provide the services for Ocean County, and it is a 365-day a year, 24/7 urgent program, which you can access from performcarenewjersey.org. It's available to any parent who has a child 21 or younger. And if they call this toll-free number, it's dispatched by county. A team of 1 to 2 mental crisis intervention specialists will come to your home within 1 hour. So we provide that service in Ocean County. And the nice thing is that the emergency is subjective. So it's whatever you consider an emergency in your household with your child. It doesn't necessarily have to be that they're suicidal, or I mean, that does happen, trust me, but it's subjective to what's a crisis in that household.
Interesting. So how does the program work for families who maybe are underinsured or don't have insurance? Is that a state subsidized kind of service? How does that work?
I mean, we do have grant funding for populations, and a lot of times it will be undocumented citizens, who do not have health insurance. So we do have grant funding to provide services for individuals with no coverage, but for the most part, our clients do. We provide services to 70 to 75% is Medicaid, but the majority of our clients do. But we do have grant funding for clients who don't.
Gotcha. One of the things we hear about from all types of healthcare organizations is they're having staffing issues. Have you experienced that at all, or like getting providers and even admin staff?
Yes.
You roll your eyes immediately.
Yes. I mean, I think it's just, it's not an industry specific thing. I know it's global, the Great Resignation, the she session versus the recession. A lot of women have left the workforce, but yes, we are not immune to it. We probably have the most vacancies we've ever had in the history of our 45 plus year existence, with about 10% or more of our workforce being reduced. We have that many openings. So, I think that, these are my theories, and I know that I'm sure there's literature to back it up as well. But I think that, for a good part of COVID, that people learned how to live with less because they weren't going out, they weren't spending money the way they used to. And I think it put a lot of people's lifestyles and what's important to them into perspective. And they don't want to grind like they did. And if can get by on one salary, then why, not be home with your kids? But I think something that's industry specific for us is that, like I said, 80% of our workforce is clinical. And even myself, I have a private practice outside of Preferred Behavioral Health Group in Monmouth County. And, we all, dabble in moonlighting, nights, weekends, things like that. And there were a lot of people in our fields that never wanted to sign a lease or get themselves kind of in debt or take on that kind of financial responsibility. Now, with telehealth services, you can hang a virtual shingle with like a $14.99 Zoom account every month. So it's not as prohibitive or as much of a commitment as it used to be. And I think that a lot of people found that appealing. They can work for themselves, they can make their own hours, they can be virtual, they don't have to go anywhere. So I think that has been kind of a big impediment as well.
It's an interesting perspective. I never thought about that people had really during COVID minimized their expenditures and their lifestyle and travel and everything else. And that allowed them to perhaps, not work at all or take a job that's lower paying and do it remotely and maybe even move out of the city into a more affordable area.
Absolutely. And 82% of our workforce, just in general, globally, is women, kind of like teaching, nursing. So counseling, social work, behavioral health tends to be very female dominated. And, we still do live in its reality that, a woman makes 72 cents to a man's dollar. So if you're in a heterosexual relationship and, your partner or your husband is making more money and you're not, the woman stays home. And there's been a lot of that across the board, And
Absolutely.
people just reevaluated their lives.
Yeah.
So,
which could be a good thing at times, I suppose. But
we're all about promoting work-life balance and good self-care, and I also think that we are living right now in a time where prices are elevated, childcare costs a lot of money. So it's just kind of like looking at, can I do this? And if you could, why wouldn't you?
It's so true. I mean, I think the average income in New Jersey is around 50K, right? And
yeah,
the cost of healthcare is what? It's got to be, probably 2-3K a month. And like, it's after that, like how much money is left over after taxes and everything?
right. I know. And the other piece too is we have over 70 programs, and a majority of them are grant funded with a very fixed budget.
Right.
So one of the biggest gripes is, especially with COVID and being with clients in closed spaces and driving a car with them, it's kind of like people want hazard pay. They want more money, and we want to give it to them, but we're limited. If this is our nut, and we can't grab funds from elsewhere, we're very limited in being able to give people more money. And so those are the biggest impediments that we're finding.
Sure. How have you say you have 70 programs? That's a lot. So like, give me an example of some of these programs that you're running.
Okay, so one is the Children's Mobile Response.
Right.
We have a traditional outpatient, like if you want to go just talk to somebody. We have day programs, which are typically for people with very acute mental health needs, or if they're being discharged from a hospital setting, where we have programming 5 days a week for both mental health and substance use. And we have the same for adolescents. We have case management programs. We have peer programs for substance use services, in-home recovery programs. We have therapeutic visitation for parents whose kids have been put in foster care. So we do therapeutic visitation or supervised visitation. We have school-based programs, which have been in the news a lot lately, with Governor Murphy and funding. So we're in a few different school districts. So we have a lot going on. We have a lot.
Wow.
Yeah.
Sounds like a lot to manage. You must have your hands full.
Yeah.
So how does like the average patient hear about Preferred? Is it through are the adolescents finding you through their schools, or are parents just like finding you online, or is it physician referrals? How does that happen?
Yeah, so all of it. We're on social media, so we have a large social media presence on all of the outlets. We have school-based programs, but we also have long-standing relationships with schools. We get referrals from physicians, we get referrals from hospitals, insurance companies, and some of those grant-funded programs are kind of like direct access. So we get referral sources from state entities. So it's really a wide variety.
Excellent.
Yeah.
So how have you guys gone or transitioned to be more tech friendly and doing a lot of virtual stuff? How have you guys evolved over, since COVID really?
Yeah. So funny thing, and I've said this to a couple of colleagues, that pandemic, we would sit in these big meetings, all of us so smart and kind of like scratching our heads, like, how are we going to overcome this obstacle of transportation? Like for clients who don't have access to either their own transportation, public transportation. And then, March 13th, 2020 happened, and we pivoted literally on a dime to 100% telehealth. And it was kind of like, duh, why didn't we think of this sooner? We needed a global pandemic to force this to happen. So, the majority of our services are completely face-to-face again, but we do have, a pretty decent fraction of business that is still telephonic or telehealth. And it isn't going away because it has filled in so many gaps. And linked services that they previously didn't have access to. there's plenty of people that prefer face to face. When you're thinking mental health and the relationship that you're cultivating with your therapist or your provider, there's something to be said, for sharing that space and observing nonverbal behavior and kind of, what people are like, the energy that they're putting out there. So
yeah, body language, like everything, right?
Absolutely. It's just as important as our words. So I would say that we're probably like 2/3 in person and a third virtual, but we really, we want to be present. We want to have those boots on the ground, but also have that option, which is really valuable to pivot to virtual or telephonic when we need to.
So when you say virtual, you're talking about the actual, let's say like a psychology session, but are your staff working from home or are they in the office doing telemedicine appointments?
A mix of both, but again, the majority is in the office.
Right. That's actually, it's nice because more people have access to care in that capacity, right?
And that's something too that's given us flexibility for our staff where they can be home more and kind of work less traditional hours. So that's something too that I think was a plus that COVID really kind of showed us we can do this. Someone can work from home a day or two a week and be productive. So it's a healthy mix of both.
Yeah, I remember those conversations too, pre-COVID and pre-Zoom, like trying to, with our own company, trying to figure out like how can we be more efficient, like going to in-person meetings, you can only hammer out maybe 2 in a day because if you're traveling around, but with Zoom, I can do 8 or 9 in a day and it's so much more efficient. But before that, it was like, I just thought, people don't want to deal with Zoom. People won't get the technology, especially an elder individual can't figure it out, which is all BS, right? Like you can figure it out and it works pretty seamlessly most of the time.
For sure.
So tell me, are there any other challenges you guys are facing as we head into the future? What are some things that, you're keeping your eye on, or whether it's legislation or what insurance companies are doing or any kind of technologies that are coming into the industry?
Yeah, again, all of it. We work really closely with our state industry organization, the New Jersey Association of Mental Health and Addiction Agencies, always keeping our eye on funding and making sure that we're lobbying for the money that we need to pay people what they deserve to be paid, to provide the services that we need. The biggest hot button item that's really kind of impacted us recently is that we've had funding from the state for well over 20 years to provide those school-based services that I had mentioned. And initially, the governor had taken the funds away, then we got them back. Now there's a proposal for new funding where we're not necessarily going to be in the schools, but there's going to be these regional hubs to try to reach more students. But we don't know how that's going to work because they're not really embedded in the schools anymore. So, things like that are always on our radar because we want to add services. We don't want to take anything away. So things like that are really important to us.
I remember reading something about, I think it was in California. It's California or Washington, somewhere on the West Coast. And they were saying that they're considering requiring a mental health professional to be mandatory in every school, just like a nurse is in every school, that there's a mental health individual.
Yeah, absolutely. That would be a dream come true. And the school districts that do have these state-funded school-based youth services, can't imagine living without them. But it seems, fiscally impossible to have that in every school. So these hubs are kind of being proposed to be an alternative. But we're in the proposal phases. We don't know what that's going to look like yet, but we want to get more services, not less. So,
of course.
Yeah.
Tell me about, I've been hearing also talk about the what is it? Spravato. Have you heard of Spravato before? It's the ketamine treatments for depression and PTSD and stuff of that nature. Are you guys working or doing anything like that? And what are your thoughts on it?
I definitely think that there is merit there, and the efficacy is there. We have looked into doing it, but for us, and it's not to get into the weeds, we really can't afford to do it and kind of make a profit. I don't want to sound like like
no. I mean, listen. At the end of the day, it's a business.
Operating
at negative.
Yeah, it's not a cost-effective service for us
Gotcha.
at this time, but definitely something that we are not averse to, and really, understand that there are benefits there for sure.
Gotcha. So what would you like? What is something that you wish other healthcare executives knew about either Preferred specifically or just the mental health industry as a whole, or behavioral health? And what is it exactly, if I may, what's the difference between mental health and behavioral health?
Nothing.
Okay.
They're used interchangeably. Yeah. And I mean, we're a behavioral health organization. But I think overall, and I'm not speaking as an executive, I'm speaking, more as just a human being, that we really need to, across industries and just across the board, we need to really destigmatize mental health and really understand that there is no separation of mental health and physical health. And, at Preferred Behavioral Health Group, we are an integrated care provider. So we look at the whole person and kind of combine primary care and behavioral health care. But we need to just be okay to talk about it. And I think that would really alleviate so much of so many people suffering in silence. Because, if we twist our ankle, we'll go to the urgent care. But yet, if we feel broken, we're reluctant, let alone to do anything about it, but even to tell anybody. And it's 1 out of every 2 people. So, we're all affected by it. And if not us, then someone in our family. And we just really need to normalize it. Go talk to someone. Go see a psychiatrist. Like, it doesn't mean you're crazy. It doesn't mean you're damaged. It doesn't mean you're broken. But we all need help. And that's something globally that we all need to embrace, regardless of, what level of management we're in or what industry we're in. We just need to make it cool to talk about it. It's fine.
Do you see a big disparity between men and women who are seeking mental health treatment and care?
Yes. It's and that's statistically the truth. It's like it's 2 to 1. For every 2 women, 1 man is going to get help, and I think part of it is just cultural and gender norms, and don't cry, don't talk about your feelings, whatever it is, and it it all just kind of cascades. But without a doubt, I mean, that's like a textbook statistic that it's 2 to 1. Mm-hmm.
Yeah, I mean, it makes sense. I could just picture myself if I was dealing. I would be more hesitant than my wife, who's like, "Yeah, I'll go, no problem, no qualms, just go for it."
Absolutely.
So excellent. So how can people learn more about you and your organization? What's the best way to either get in touch with you or just get some more information?
Sure. So we have a website, and it's www.preferredbehavioral.org. We are also on all social media outlets under the same name, Preferred Behavioral, and I have social media as well. I'm on Instagram, and you can Google me, Dr. Tara Chalakani, and I'm happy to help answer questions and be a resource.
And you have your own, you said, practice on the side. So are you actively taking on patients, or or are you kind of
on a limited basis? But my website is www.peacefulmindscounseling.com.
fabulous? Yeah, we'll definitely add those links when we post this video.
Thank you. I really appreciate it.
Absolutely. So, any parting words for people out there?
Well, you know what? The holidays are here, so I think it's important to highlight the fact that although it's the most wonderful time of the year for many, it's also a very stressful time, and that we really need to pay attention to what our limits are. If something feels like too much, say no. You know, when we say no to something or someone else, we're saying yes to ourselves. So, you know, if it's just one party too many, bail out, take care of yourself, watch what you eat, get enough sleep, move your body. We're eating and drinking more and different foods that we don't normally consume. And, you know, we might not feel our best, and we really need to take care of ourselves.
Yeah, well said. Well said. Well, Dr. Chalakani, thank you so much for being with us today. It was a pleasure speaking with you, and we look forward to hearing from you soon. And I guess enjoy your holidays.
Likewise, same to you.
All right. Thank you very much. Have a good one.